coronavirus threat?
It's been almost 3 weeks since India began lifting
Coronavirus outbreak.
So everything was shut down, right? I mean, you guys were locked in.
We at Project Arogya started out with a vision of providing affordable, accessible and acceptable healthcare services in the rural and the peri-urban areas, which was brought to life by the Arogya Health Center, with expanding through telemedicine, mental health counseling and our medical waste management unit, Clean Egg.
We started our journey in Hapur, Uttar Pradesh in 2017. A multitude of need assessment surveys showed us that the villagers spent at least 800 rupees per visit on basic Medicare facilities. The existence of a branded nexus between commercial health centers and pharmacies made the affordable alternatives unknown to them.
With this began the first avenue of our project, the Arogya Pharmacy, specializing in the retail of generic medicines certified by the NABH. Having the same chemical composition as their branded counterparts, these medicines proved to be equally effective and were at a 70% lower rate due to non-commercialization.
With the help of local B Pharma graduate Ashwin Bhaiya, we set up our own generic medical store. The initial capital was put in by a head pharmacist as a part of an MSME loan under the Pradhan Mantri Kaushal Vikas Yojana, while the inventory and the marketing costs were handled by Enactus Ramjas.
To penetrate the local market, we conducted rigorous marketing sessions and weekly health camps. To estimate our impact and structure our need analysis, we established the Arogya Health Index under 10 parameters verified by the World Health Organization.
As our next step, we partnered with the local diagnostic centers and converted the Arogya Pharmacy to the Arogya Health Center with a sample collection unit and an OPD where the customers could avail primary health checkups at rates 60% lower than clinical consultation.
This diagnostic unit was co-owned by our partner Mahavir International and REMT, trained under the NSDC paramedic program. Additionally, we also appointed a manager from the local community to handle operations and supervise the health center.
This AHC provided inexpensive primary services to over 20,000 villagers, reducing the annual medical expenditure by 73%. Out of an annual revenue of 3,90,000, the profits generated were equally divided between our beneficiaries, boosting their income levels by 120%. In 12 months of operations, we recouped our investment, making the unit run independently by our beneficiaries, hence becoming sustainable.
Learning from the success of our first Arogya Health Center and guided by the Arogya Health Index, we decided to replicate our model. Partnering with healthcare institutes all across the nation, we have set up 24 units in Delhi, Rajasthan, West Bengal and Odisha, addressing a total audience of 3 lakh individuals over the past 2 years.
By connecting all our existing pharmacies at the supply level, in 2019, we adopted a supply chain model for all our centers in Delhi NCR. This incentivized our Arogya supplier, standardized by the WHO, to a 2% profit share, increasing the circulation of generic medicines by 62% in Arogya primary healthcare system, thus establishing a virtual presence for affordable Medicare.
Realizing the importance of accessibility as much as affordability, we decided to introduce teleconsultation and digital prescription with real-time reports. Connecting with medical professionals via video conferencing, people did not have to travel 15 kilometers for basic medical consultation anymore.
Further, in telemedicine, we established a mental health care wing to induce awareness about mental health disorders and therapeutic measures for our customers. With over 1,200 consultations in the first 5 months and structuring the proof of concept, Tele Swasthya began its journey.
Although our health centers took a 45% hit in revenue due to the nationwide lockdown, we collaborated with arogya.org to tackle digital healthcare with a much broader impact.
At Project Arogya, we understand the detrimental impact of medical waste and its serious environmental implications. Hence, we partnered with Stive Solutions to launch the Arogya Clinic Unit, a mobile medical waste management system with sustainable technologies of microwave sterilization and bioaugmentation to safely dispose non-reusable medical waste generated from the 24 Arogya health centers to prevent 6,700 kilos of medical waste from contaminating the environment, consequently reducing 7.3 tons of CO2 emissions.
Project Arogya continues to grow and was recognized and guided by the Minister of Health and Family Welfare and the 34th Director of the World Health Organization, Dr. Harsh Vardhan.
दवाई के पैसे बचने के कारण मेरी बेटी सफल जाती और मेरी सेहत बेहतर है।
My heart fills with joy, when I see the kind of work that all of you have done. It is definitely remarkable and something very, very thought-provoking, because it is just not about empowering the transgender persons, but it is also about giving them that equal space and that opportunity to help them explore themselves and also effectuate the kind of work that they learn, the skills that they acquire.
Imagine a world so distorted, where you'd be denied a basic service such as getting a haircut, where you'd be shooed away for making other customers uncomfortable. That being one of the many prejudices a trans person faces on a regular basis.
Thus, we conducted various need assessment surveys to deliberate upon an affluent business model for the transgender community located in and around the area. And the people, upon introduction, were more than excited to be the customers of what they called Hamare Khud Ka Parlor, with a sense of belongingness and an unrealized sense of need. Thus, Vibcure, Trans Creation's first ever beauty parlor, to be run by the trans women community, came into being.
With Parvez ji as a head salonist, we collaborated with Shape India and set up the parlor inside the premises of the NGO to ensure a protective environment and also cut down on costs such as rent and other variables.
Providing in-house services at affordable rates and conducting extensive marketing spread over 6 months, Vibcure acquired a monthly customer base of 300 people and generated a monthly revenue of over 60,000 rupees.
The parlor was registered and operated under our head salonist, having 2 junior apprentices. Out of the profits generated, 60% went to our beneficiaries, while 30% was given to our partner NGO and 10% to Enactus Ramjas to recoup our investment. As of January 2020, our beneficiaries' income has increased by 125%.
With recognition from one of the lionized cosmetic brands, the Godrej Group, our beneficiaries received advanced training and an initial capital of 1 lakh rupees to set up 2 parlors under the Godrej Salon initiative with our non-profit partners Arohan NGO and Mitra Trust, each with an estimated target audience of more than 7,000 individuals.
Realizing the immense need to build awareness and to interweave the LGBT+ community in this global crisis, we are launching a virtual platform by the name of Transit.life. This created a network of multiple members across the nation to access company listings from gender-inclusive corporates such as Uber, Zomato, and even Trans Creations Parlor for virtual and post-lockdown employment opportunities for the community.
Also being cognizant of the post-COVID world, we introduced the salon at home model, with an online management software virtualizing customer interactions and data assessments in order to provide quality doorstep services across Delhi NCR.
The project is now registered with the United States of America's National LGBT Chamber of Commerce as a pro-LGBT business from India. And our business concept is now being adopted by the transgender community of Portugal.
I cannot believe how well the trans person community here in Portugal responded to the idea. We are definitely going to open our first transgression parlor here in Algarve.
As we breathe into a new world, our vision has also adapted.
Project Arogya is currently working on expanding to online pharmaceutical brands like 1mg and NetMeds to virtualize the reach of generic medicines to over 70,000 people and connecting the Clean Act system to over 5 hospitals, enabling us to dispose over 5,000 kilos of medical waste all over Delhi NCR.
Project Transcreations is all set to enter the post-COVID world with protective measures and checks in place with the salon at home model to generate an estimated revenue of over 20 lakh rupees and catering to over 15,000 customers by August 2021.
Enactus students all across the world have always sought for social change.
So our answer is yes. We were locked in.
We had to work from home.
We were distanced.
We collaborated.
We also believed.
We believe that we will do it again.
We are Enactus Ramjas, and this has been our story.